For employers, there's a legal requirement to have physical first aiders to keep an eye on people's health, because mental health first aid, it's the mental health version of that. It's having someone that you can talk to about your mental health in lots of workplaces, organisations, etc. Why we need mental health first aiders is really that there's still a lot of stigma around. People are more aware of mental health, but the confidence to talk about it in a workplace in particular, there's still a lot of work to do there. Still lots of stigma. People are still very fearful. Will I have a job if I open up? Will I be seen as promotion material if I dare to talk about my mental health? That kind of thing. So there's a really important role as mental health first aiders to be that first contact that encourages people, that says it's okay, it's all right. We're working away and we're working so hard, we're either physically and mentally, and often both, not really well enough to be in work. But we keep pushing and we keep going because we think we should. Maybe there can be a culture of long hours. Maybe there isn't a leadership in an organisation that kind of says it's okay, it's allowed to be unwell sometimes, and we all need help at times. We're nowhere near our A game if we're not very well. That's when we make mistakes. That's when you CC somebody into an email that you didn't mean to. That's when you mess up. There's a business case for mental health first aid, for greater involvement of people, greater understanding around mental health. It's about making sure that it's not such a long, hard road for people to get help, that it's as easy as possible. There's still so many barriers in people's heads to seek help around mental health. Anything we can do to knock them barriers out of the way has got to be a good thing, really. What holds people back often is the thought that, well, I'm not trained, I don't know the right words. Phrases pop up in people's heads like, oh, it's going to be like treading on eggshells with Mike. What if I say the wrong word? What if I make it worse? What if I mess it up? Maybe it's better not to try. Most people would rather you tried. If you spot signs of somebody's mental health appearing to change, or just someone's behaviour, just that gut feeling that something's up, something's wrong with the person, just saying, I'm worried about you, mate, I'm concerned about you. People really like that. It works, it can help people really. And then if the person does feel able to tell us, if they find any way of saying, often it can be quite reluctant, it can be, I hate you for saying that, but I'm not sure I want to talk about this, but you're right, something's going on and I don't really understand it. Then it's about listening, pinning our ears back and listening to what they've got to say. It's about encouraging them, saying you've done the right thing. You've come a million miles just being prepared to even talk about this. Having some ideas of who to go and talk to. There's an anti-stigma campaign called Time to Change. One of their campaigns around it was the idea of ask twice. We never recommend you ask a person if they're all right twice in the same kind of 5 seconds, because you're just going to annoy people, is the truth of the matter, so don't do that. But if somebody else can ask the question in a different way, in a different voice, maybe literally in a different language ultimately, or maybe it's just a younger person, or it's a woman, or it's a black person, just somebody else putting it in a different way might make a difference. Being prepared to keep trying is the big thing, really. We think it's a really good training package. It offers really good information around mental health awareness and confidence for people. We train them to spot the signs, to understand what triggers people's mental health issues, and then to be in a position to encourage people to get help, seek help, not feel daft about it, not feel they shouldn't talk, but feel that it's a good professional thing to open up. We take out to workplaces, colleges, universities, you name it, and we now work with a number of other mental health first aid instructors to deliver the trainings. Mental Health First Aid England, who have the responsibility for the training, who train me, all the other instructors, they have this goal, this mission of 1 in 10 of the population of England having done the training. So we've really got enough eyes and ears. We've had people who've done the training and they got back in touch and they said, you know what, I'm really glad I did the training, particularly that section around suicide prevention, because I found myself in a situation where I had to deal with someone who's trying to tell me they've had thoughts of suicide, and I had to ask them the question. Sometimes people say, well, even if I haven't had to use it at work yet, I had to use it with my brother, or I had to use it with my best mate. It encouraged somebody just to go and talk to their doctor when they were terrified. If it makes a real difference in people's lives, then that's job done for us. That's what we're about. Certainly at least one example of a police officer who found himself at the top of a multi-storey car park with someone who was threatening to end their life, and he talked them down, and he told us the training helped. I don't think it gets better than that. You can't get better feedback than that in terms of what motivates me to do the work. Certainly we've had companies come back and say they feel that it's helped change the culture, shift the culture around mental health.
I first got involved with the community development team at Birmingham Mind because I had identified a need for our barbering team to become educated on the different mental health conditions and also services that are available to people who are experiencing those conditions. The mental health first aid course definitely increased my confidence in discussing any kind of mental health issues or, problems that people may have with both clients and with staff. Whereas before I'd be at a loss as to know exactly what to say and how to deal with it. Whereas now I know that you don't need all the answers. You just need to listen, understand, and then obviously be able to point people in the right direction of the different services that are available to them.
In terms of accessing the training, the simplest way is to contact Birmingham Mind, training@birminghammind.org. That's our main contact email for accessing the training, finding out about mental health first aid. In terms of more generally around your mental health, particularly for the Birmingham area, then Birmingham Mind has a 24-hour helpline, so we'd certainly advise people to contact that. Whatever time you ring, you're going to get to talk to a real human being. And you can ring that number and talk about your concerns about another person, hit their brains, get some advice about how to approach it, how to have that conversation with them.